Chapter 5. Ava woke even stiffer Friday morning. How was that possible? Shouldn't 2 adjustments have helped if it was a pinched nerve? Did that mean it was something more serious? Something she should worry about? Amazed she had been able to sleep in the bed instead of the recliner, Ava braced for the pain as she pushed herself upright. Sure enough, it washed over her, a tidal wave of tightness, stiffness, and the feeling of a knife jabbing into the right side of her neck. It took a moment for the blackness to fade and the room to stay still enough that she could stand. A shower sounded like the most painful thing on earth at the moment, but she hadn't taken one yesterday. 2 days was her limit. Even after Kylie had been born, she'd snuck into the bathroom and given herself as much of a shower as she could. The second day, much to the chagrin of the nurse who found her there, she'd taken a tongue lashing and been forced to promise she would call for help next time before she attempted a shower. But at least she had gotten clean. The gritty, slimy feeling had left her hair and taken the constant itch with it. And that was all Ava was hoping for today. Just enough clean to not feel gross. She peeled off her clothes and stepped into the warm shower. The water pelted her neck, but not in a painful way. Washing her hair, on the other hand, nearly brought her to tears. Unable to lean her head back, she backed closer to the shower head and let the water pour down her face. She scrubbed the soap out while trying to stay as still as possible and breathed a sigh of relief when the cleansing process was finished. But drying off was no less painful. Trying to dry her hair without moving her neck proved impossible, and she stopped when the pain became unbearable. Her hair wasn't dry, far from it, but it could air dry the rest of the way. "Mommy!" Kylie's yell came from down the hall. They had taken the railing off her bed a year ago, but she still refused to get up herself. "Coming," Ava hollered back. Nothing like rushing to get dressed when you could barely move. She pulled on a pair of sweatpants and a loose-fitting shirt before heading down the hallway to Kylie's room. "Morning, Bug. You ready to get up?" "Can I stay home with you today, Mommy?" Kylie asked as she sat up and rubbed her eyes. Her little stuffed lamb, once a pure white color but now loved to a dirty beige, was clasped tightly against her chest. "Not today, baby, but it's Friday, which means tomorrow is Saturday, and that's a stay home all day with Mommy day." Ava opened Kylie's drawers and pulled out her clothes for the day. "Okay, Mommy." Ava smiled as Kylie followed her downstairs. If only everyone was as accommodating and easy to please as her 4-year-olds. Ava dropped her keys on the table and sank into the recliner again. The 3rd adjustment had been less painful, but Chris had promised she would have more movement, and she still didn't. It still hurt to move her neck and swallow. Something else had to be going on. As she pulled up her email, a message icon popped across her screen. Results from her x-ray had posted to her health account. Unsure she would understand the medical jargon, but curious as to what it might say, she logged in and clicked on the medical record. The report wasn't long, but the words sent a spear of fear into her heart. Impression: unremarkable bony structures of the cervical spine. Non-specific prevertebral soft tissue swelling from the C1 level to the C4 level. Clinical correlation for possible prevertebral infection is recommended. Consider CT neck with contrast to further evaluate. Positive alert. The results of the study have been annotated as abnormal in the patient's electronic medical record. Prevertebral tissue swelling? What did that mean? Possible infection? CT scan? Abnormal? Suddenly, Ava was convinced this was not just a pinched nerve. She grabbed her cell phone and dialed the number to the clinic. Hopefully, she hadn't made things worse by waiting so long to be seen. It was only 2 days. Surely 2 days wouldn't matter. "Family Health Center, how may I direct your call?" "I need to set an appointment to be seen," Ava said. The woman transferred her to the right department, and Ava rattled off the details of the x-ray report. "I can get you in Monday morning with Dr. Stedman, but that's the earliest appointment I have," the woman on the other end said apologetically. "That's okay, I'll take it." But Ava wasn't going to wait another 2 days to be seen, not with the words abnormal hanging over her head. She might have to sit there for hours, but her clinic had an urgent care department. At least she would get seen today. She tucked her laptop into her bag, grabbed her keys, and headed out for the second time. The urgent care department was surprisingly slow when Ava arrived, and after being checked in, she was whisked quickly back to the triage room and then down the hall to a more permanent room. A nurse peppered her with questions before promising to return shortly with the doctor. Ava sat in the chair and tried not to let fear overtake her. A few minutes later, a large, friendly black woman entered. "Ava, I'm Dr. Jensen. I've looked over your results and I'm lining up a CT scan immediately. It may be nothing, but infections in the neck are never something to mess with, okay?" "Whatever you suggest. I just want the pain to go away. We do need to get you on the bed. Erica needs to put an IV in because this CT will use an iodine contrast. Can you lie down?" Ava sat on the bed. "Lying down is a little tough, but I'll try." The doctor pushed a button to bring the head of the bed up so that it wasn't as much of an incline, and Ava gratefully leaned back. The position still wasn't completely comfortable, but it was much better than laying flat. "All right, Erica will get you set up, and then someone from the CT unit will be in to get you. I'll be back once I have results." "Thank you." Ava watched as the nurse inserted a needle into her veins and began to draw blood out. Normally, she hated having blood drawn, but the pain was so minor compared to the aching in her neck that she didn't even care. After filling 4 vials, the nurse plugged in the piece that would attach to the IV and left the room. Ava pulled out her cell phone and opened her book app. She couldn't write, but maybe she could pass the time reading. She rarely got to anymore since most of her free time was spent writing. "Ava Miller?" Ava glanced over at the door where a young woman stood with a wheelchair. "That's me." The woman helped get her situated in the wheelchair and then pushed her out the back doors of the clinic. "I know it seems odd, but the CT scanners are housed in these mobile units. Don't worry, though, they work just the same." Ava would have nodded if she were able, but as the statement didn't appear to require an answer, she didn't give one. The woman maneuvered the wheelchair onto a ramp and then pressed a button to raise the ramp. When it stopped, she manually lifted the metallic closure and the interior of the trailer was exposed. It looked like a miniature lab with another technician manning a computer just outside of the CT machine. "Have you ever had a CT scan with contrast?" the technician asked her. "I don't think so." Ava wasn't even sure she'd had a CT before, much less with contrast. "Are you allergic to iodine?" "Not that I know of." What happened if she was? Visions of her coding or going into some sort of shock filled her mind, and she closed her eyes to force them away. Sometimes having the imagination of a writer was a curse as much as a blessing. "Can you lie back?" the woman asked. "Not without help," Ava replied, and the two flanked her and helped her lie back. "Okay, now when the iodine hits, you're going to feel a warm sensation. It might even feel like you've wet yourself, but don't worry, that's normal." Ava wasn't sure how that could be normal, but she said nothing. "Be sure to keep your eyes closed throughout the procedure, and there's a few times I'm going to ask you not to swallow." No worries there. Swallowing was extremely painful, and she avoided it at all costs. The bed she was on moved, and Ava shut her eyes. A few minutes later, the CT scan was done. The technicians helped her back up, and the woman who wheeled her out wheeled her back to her room. Before climbing back in the bed, Ava grabbed her computer and placed it beside her along with her phone. She should have brought her charger in, but she couldn't imagine she would be here much longer. She was wrong. It was an hour later when the nurse finally returned. "Looks like I need a little more blood, and then you need to get this antibiotic, which takes about half an hour to administer." "Antibiotic? So it is an infection then?" The nurse appeared thrown by the question. "Dr. Jensen hasn't been back in yet?" "No one's been in for over an hour. I was beginning to think you'd forgotten about me." "No, we haven't. I'll get you started and then check in with Dr. Jensen." The nurse filled a few more vials with blood and then fiddled with the IV plug for a minute until she appeared satisfied the IV was hooked up correctly. "Back in a bit," she said as she exited the room. Ava sighed. An infection wasn't great news, but antibiotics generally cured them, and at least it might mean faster relief for her neck. "Oh, good, Erica got you set up," Dr. Jensen said as she re-entered the room. "So it does look like you have an infection in your neck. I'm glad you came in when you did. We don't want an infection like this getting into your bloodstream." "How would I know if it got into my bloodstream?" You would probably have severe chills or fever. If you have any of those signs, you need to go straight to the ER, not here. Do you understand? Yes, ma'am. I'm prescribing you a strong antibiotic that you need to take for 10 days, along with a muscle relaxer and some pain medicine that you can take as needed. I want you to set a follow-up appointment for a week from now to make sure everything is improving. I can do that. Ava would do just about anything if it would lessen the pain she was feeling. Good. Erica will be back shortly with your discharge paperwork and your pharmacy papers. I hope you feel better soon. So did Ava.